Last month, the government announced the operationalization of the anti-tobacco law. However, the results of the move are yet to be realized close to 2 months later. With so much hype about the legislation prior to its passing, skeptics have since predicted the so-called norm of failure at implementation of policy. Honorable Rosemary Nyachikongoro is quite disappointed with the enforcement of the law.
And we want to ensure that Ministry of Health comes up with regulations, publishes them, engages the public. It is the responsibility of the Ministry of Health to even sensitize the public about the dangers of tobacco smoking, about the law that has been implemented. Yes, the law has been implemented. You know, in Uganda, we've been quoted in different areas that we pass. By the way, this tobacco law is the best in the whole world. The Ugandan tobacco law that has been passed, it is the best in the entire world. But how do people know? Do our peasants know? Do even those who smoke in public places know? So these are some of the things that civil society should come up and hold government, because now it is a government law, to hold government accountable to ensure that there is concrete sensitization to the public.
Uganda is ranked highly globally in alcohol consumption. However, the consequences of its abuse have pushed stakeholders to prepare the Anti-Alcohol Bill 2016.
Look at how much government spends on the medical bills for cancer people. People don't look at that, and they just continue to out of ignorance. So alcohol control law is in the offing, and we want to call upon Ugandans to support it. If you want to drink, let there be limitations. In the morning, people drink from morning up to evening when they do work. No wonder that's why we are still poor as a country, because that manpower is involved in drinking throughout. Drinking should be regulated.
But we sought to find out Uganda's stand in global commitments in the fight against non-communicable diseases.
What I know is that the ministry is planning to complete the policy and make it truly multi-sector, so that other sectors have a stake in this policy, and when it comes to implementing, it's not left to the ministry alone. So yes, there is a draft policy that is yet to be completed.
Most non-communicable diseases require a pattern of regular visits to medical personnel. On an unfortunate note, patients discover when it's too late or have no idea that they are sick, the reason why mortality is high.
If you look at NCDs as a health sector issue, we will not succeed. Because we're not going to control taxes on cigarettes or tobacco. That's not a health sector mandate. We are not going to control drinking hours and packaging of alcohol and accessibility of alcohol by the minors. So it is beyond the health sector, and the global community has insisted that we must have a multi-sector committee in charge of prevention and control of NCDs. We've been trying to put that in place. We've written to many sectors. The response is not as good yet.
The Uganda Cancer Institute is at the forefront of the cancer fight. We talked to Dr. Nole Mugisha, a cancer specialist, on the way forward, plus the bottlenecks currently plaguing the institution.
I think we are fairly prepared. We do not have every single resource that we need to provide cancer care in a timely manner. And when I say that, is that we don't have enough oncologists to see every patient who comes there and then. But I must say that also cancer is not like malaria, that you come in, your blood is positive for malaria, you're given quinine, you go back home.
Government is on the spot for alleged neglect of the health sector, with concerns raised on the issue of funding health care, the state of health facilities, emergence of new diseases and scourges, the plight of health workers, among others. According to Dr. Anthony Mbonye, Director of Public Health, the government is aware and the Cabinet has okayed the NCD policy, although funding is still the main challenge.
Policy-wise, we have a policy on non-communicable diseases. We have a section that we have raised to the department, and we are going to staff it. We have a dedicated budget for non-communicable diseases, and we think once we get more resources through like this stakeholder meeting involving the development partners, and we put more resources, we think we are going to have an impact on the non-communicable diseases.
So much awareness has been made for diseases that rapidly spread from one person to another, either through contact with pathogens, often leading to infections, but not the case with those that develop through an unusual lifestyle. Reporting for WBS Television, Edwin Mahomza.